In January 2025, a woman named Kara Trainer stood in front of reporters and described how a single prescription changed the course of her life. She was 21 years old when a back injury sent her to a doctor. The doctor gave her OxyContin. She had no idea that one prescription would affect the next 2 decades of her life. Kara survived. Hundreds of thousands of Americans did not. Since the opioid epidemic began, overdose deaths have climbed into the hundreds of thousands. Entire communities were devastated. Parents buried children. Children buried parents. And one pharmaceutical company kept appearing in the story. That company was Purdue Pharma. For years, Purdue sold a powerful painkiller called OxyContin. The drug generated billions of dollars. Doctors prescribed it. Patients trusted it. Investors celebrated it. And the family behind the company became enormously wealthy. The family was called the Sacklers. To many Americans, the name meant generosity. Their donations appeared on museum walls, university buildings, art galleries, medical institutions. For decades, the Sacklers were known as philanthropists. Very few people knew where most of that fortune came from. But outside those museums, another reality was unfolding. Emergency rooms were filling up. Addiction clinics were overwhelmed. Police departments were responding to overdose calls every day. Entire towns were struggling with a crisis that seemed to appear from nowhere. And many of those stories started the same way, with a prescription. As the crisis grew, lawsuits followed. States sued Purdue. Cities sued Purdue. Counties sued Purdue. Victims sued Purdue. By the late 2010s, the company faced thousands of legal claims. The pressure became impossible to ignore. Then investigators started following the money, and the numbers were staggering. According to settlement-related reporting, the Sackler family received roughly $10.7 billion from Purdue between 2008 and 2018. The deeper investigators looked, the bigger the questions became. Years later, Purdue would file for bankruptcy. The Sacklers would lose ownership. A massive $7.4 billion settlement would eventually take effect. Millions of internal company documents would become public, and a company once worth billions would effectively disappear. But by then, the damage had already been done. No settlement could reverse the deaths. No court ruling could erase the addiction. And no amount of money could answer the question victims kept asking. Who knew what was happening? And when did they know it? This is the story of Purdue Pharma, the Sackler family, OxyContin, and one of the most profitable products in pharmaceutical history, because what began as a painkiller would eventually become the center of a national disaster, and the trail of money behind that disaster would lead everywhere, including the very top. Long before OxyContin existed, the Sackler family had already changed the pharmaceutical industry, and that is what makes this story so unusual. Purdue Pharma did not become powerful because it invented the best medicine. It became powerful because the Sacklers understood something that most drug companies did not. In America, controlling the message can be just as profitable as controlling the product. The architect of that philosophy was Arthur Sackler, a psychiatrist, a businessman, and one of the pioneers of modern pharmaceutical marketing. Decades before social media influencers and digital advertising, Arthur was helping drug companies market medicines directly to doctors on a massive scale. His methods helped turn products like Valium into household names. Many of the marketing techniques that later became standard across the industry could be traced back to him. By the 1990s, Purdue Pharma was controlled by other branches of the Sackler family. The company was successful, but it was not yet a giant. Executives wanted something bigger, something transformative, something that could dominate an entire market. That opportunity appeared in the form of chronic pain treatment, and the timing seemed perfect. Across America, many doctors believed pain was being undertreated. Patients with cancer, patients recovering from surgery, patients with severe injuries. Millions of people were living with long-term pain. Medical organizations were encouraging doctors to take pain more seriously. For pharmaceutical companies, this represented an enormous business opportunity. Then Purdue introduced a new drug, OxyContin. The FDA approved it in late 1995. Purdue launched it commercially in 1996. The drug contained oxycodone, a powerful opioid that had existed for years. But Purdue presented OxyContin as something different, something safer, something something revolutionary. The company's most valuable asset was not the pill itself. It was a marketing claim. Because OxyContin released its medicine slowly over time, Purdue argued that it had less abuse potential than many shorter-acting painkillers. Internal company documents later showed how valuable Purdue considered this message. One internal report reportedly described it as a potential principal selling tool. That single claim would help generate billions of dollars in future revenue. Purdue did not market OxyContin quietly. The company built one of the most aggressive pharmaceutical sales campaigns in modern American history. Sales representatives were trained extensively. Doctors were targeted across the country. Bonuses exploded. According to a GAO review, Purdue's estimated sales bonuses grew from roughly $1 million in 1996 to approximately $40 million by 2001. The strategy worked better than anyone expected. Sales surged. In 1996, OxyContin generated about $48 million. Just a few years later, annual sales exceeded $1 billion. The drug became one of the most successful prescription painkillers in America. To investors and executives, it looked like a business triumph. But somewhere inside those billion-dollar sales numbers, the first signs of disaster were already beginning to appear. The first signs of trouble did not come from Wall Street. They did not come from Congress. And they did not come from Purdue Pharma. They came from small towns, rural communities, emergency rooms, drug treatment centers. By 1999, some treatment facilities were already reporting patients addicted to OxyContin. At the time, the drug had been on the market for only a few years. The earliest warnings appeared in places many Americans had never heard of. Small communities across Appalachia, Maine, Kentucky, West Virginia, Pennsylvania, Ohio. These regions were being hit especially hard. People who had started with legitimate prescriptions were becoming dependent on the drug. Families were noticing something was wrong long before national headlines appeared. One of the doctors who sounded the alarm was Dr. Art Van Zee, a physician in rural Virginia. He began seeing addiction spread through his community at an alarming rate. Patients were arriving with stories that looked remarkably similar. An injury, a prescription, dependence, then addiction. Van Zee repeatedly warned regulators, journalists, and Purdue itself that OxyContin was creating a growing crisis. Meanwhile, OxyContin sales continued climbing. Prescriptions exceeded 7 million annually. Revenue exceeded $1 billion per year. By 2001, OxyContin represented roughly 90% of Purdue's prescription drug sales. The money trail was becoming impossible to ignore. The more pills Purdue sold, the more revenue flowed into the company. And the more revenue flowed into the company, the more valuable OxyContin became. Then an uncomfortable contradiction emerged. If OxyContin truly had lower abuse potential, why were addiction cases spreading so quickly? Why were pharmacies being robbed? Why were pills appearing on the street? Why were treatment centers reporting growing numbers of OxyContin patients? The company's public message and the reality on the ground were beginning to move in opposite directions. Inside Purdue, people were hearing these reports too. Federal investigators later found internal sales notes from 1997 to 1999 containing words such as crush, snort, and street value. Sales representatives were recording concerns they heard from doctors and medical professionals. In other words, information about abuse was reaching the company years before the crisis became a national story. The situation became even more troubling when prosecutors later concluded that Purdue officials had received reports showing people were crushing OxyContin tablets and abusing them for an immediate high. Internal communications showed discussions about internet posts, black market demand, and growing misuse. Yet the company's marketing campaign continued. The machine kept moving, the revenue kept growing, and the warnings kept getting louder. By the end of the 1990s, Purdue Pharma faced a decision. The company could treat these reports as a threat to its most profitable product, or it could treat them as isolated incidents. The choice Purdue made would help determine the future of OxyContin, and according to investigators, that decision would eventually place the company at the center of one of the biggest corporate scandals in modern American history. While addiction cases spread across small towns, most of America still had no idea what was happening. Wall Street certainly didn't. Investors saw a different picture, a pharmaceutical success story, a blockbuster drug, a company generating enormous enormous profits. From the outside, Purdue looked like one of the smartest businesses in healthcare. Inside many communities, it looked very different. One of the first journalists to seriously investigate that difference was Barry Meyer of the New York Times. Long before the opioid crisis became a national political issue, Meyer was receiving reports from doctors, law enforcement officials, and addiction specialists. The story sounded too similar to ignore. Different states, different patients, different backgrounds. Yet the same drug kept appearing in the center of the story. As Meyer continued reporting, Purdue pushed back aggressively. The company defended OxyContin. Executives argued that abuse resulted from criminals misusing the drug, not from the product itself. The distinction was important. If abuse was simply a criminal problem, Purdue's business model survived. If the product itself was contributing to addiction, everything changed, and billions of dollars were suddenly at risk. At the same time, Purdue's sales force was becoming one of the most powerful marketing operations in American healthcare. The company rewarded representatives who increased prescriptions. Higher sales often meant higher bonuses. Higher bonuses encouraged more aggressive promotion. More aggressive promotion led to more prescriptions, and more prescriptions led to more revenue. The cycle kept feeding itself. By the early 2000s, OxyContin had become far more than a medicine. It had become Purdue's economic engine. The drug was generating billions of dollars. The Sackler family's fortune continued growing, and the company's future increasingly depended on one product. That created a dangerous incentive, because when a single product becomes responsible for most of a company's success, admitting problems becomes much harder. Federal agencies were paying attention too. The Drug Enforcement Administration, known as the DEA, began receiving growing numbers of reports involving OxyContin diversion and abuse. Investigators saw the same pattern appearing repeatedly. Large quantities of pills, rising addiction, growing criminal activity. The problem was becoming too large to dismiss as a collection of isolated incidents. Then investigators found something troubling. According to later court filings and government investigations, Purdue employees had received information about abuse years before many public statements acknowledged the scale of the problem. The question was no longer whether warning signs existed. The question was what Purdue did after seeing them, and that distinction would eventually become the center of the government's case. By 2003, the pressure was building from every direction. Doctors were raising concerns. Journalists were investigating. Federal agencies were gathering information. Communities were demanding answers. And somewhere inside Purdue Pharma, executives were facing a reality they could no longer ignore. The company's most profitable product was becoming one of the most controversial drugs in America. The next stage would bring prosecutors, criminal charges, and a disaster Purdue could no longer contain. In May 2007, Purdue Pharma finally faced the moment it had spent years trying to avoid. Federal prosecutors announced a major criminal settlement. Purdue Pharma agreed to plead guilty to a felony charge of misbranding OxyContin. 3 senior executives also pleaded guilty to criminal charges. The company would pay more than $600 million in fines and penalties. At the time, it was one of the largest pharmaceutical settlements in American history. The government's accusation was simple. Prosecutors argued that Purdue had misled doctors, patients, and regulators about the risks associated with OxyContin. According to the Department of Justice, the company marketed the drug in ways that suggested it was less likely to be abused than evidence supported. For Purdue, the settlement was a public humiliation, but for many victims, it felt like only the beginning, because the settlement did not stop the epidemic. In fact, the crisis continued growing. Millions of prescriptions were already in circulation. Large numbers of people had already developed opioid dependence, and many individuals who became addicted to prescription opioids eventually turned to cheaper alternatives, heroin, then fentanyl. The disaster had evolved beyond Purdue itself. Now it was spreading through the entire country. The human cost became staggering. Over the following years, opioid-related deaths climbed into the hundreds of thousands. Entire towns were transformed. Employers struggled to find workers. Hospitals were overwhelmed. Children entered foster care. Families lost parents, siblings, and friends. What had started as a pharmaceutical success story was becoming one of the deadliest public health disasters in modern American history. Then came the lawsuits, thousands of them. States sued Purdue, cities sued Purdue, counties sued Purdue, Native American tribes sued Purdue, hospitals sued Purdue, victims sued Purdue. The legal assault became so large that even a multi-billion-dollar company could not withstand it forever. As those lawsuits moved forward, investigators began following the money, and that money trail led directly to the Sackler family. According to court filings, filings, and later settlement documents, members of the Sackler family received billions of dollars from Purdue over the years. Critics argued that enormous sums had been removed from the company, while legal risks surrounding OxyContin were growing. The family's wealth suddenly became a central issue in the case. The numbers were extraordinary. According to settlement records, approximately $10.7 billion was transferred to Sackler family members between 2008 and 2018. To understand the scale of that figure, $10.7 billion is more money than the annual budgets of many American cities. It was enough to build hospitals, schools, roads, and treatment centers across entire regions. And now investigators wanted to know exactly where that money had gone. Then, in September 2019, Purdue Pharma collapsed. The company filed for bankruptcy protection. After decades of growth and billions in revenue, Purdue could no longer survive the avalanche of litigation surrounding the opioid crisis. But bankruptcy created a new problem for the Sacklers, because bankruptcy would expose something victims, journalists, and investigators had wanted for years. Access to documents, access to emails, access to internal decisions, and access to the inner workings of Purdue Pharma itself. After Purdue entered bankruptcy, investigators gained access to something they had been chasing for years. Documents, millions of them, internal emails, marketing presentations, sales reports, executive communications. In total, roughly 30 million company records were made available through the bankruptcy process. For journalists and investigators, it was one of the largest document releases in modern corporate history. The documents did not produce one dramatic smoking gun. Instead, they revealed something more disturbing, a pattern. Again and again, investigators found evidence of a company focused on protecting sales, expanding prescriptions, and defending OxyContin's reputation. Critics argued the records showed how business incentives repeatedly outweighed warning signs. Purdue disagreed, but by now, public opinion was shifting rapidly. The Sackler family faced a different kind of punishment. Not prison, not bankruptcy, reputation. For decades, the Sackler name had appeared on museums, universities, medical schools, and cultural institutions around the world. Now many of those institutions began removing it. The family that had spent generations building prestige was suddenly associated with the opioid epidemic. Money had built the reputation. Money could not save it. Then came another major twist. In 2024, the U.S. Supreme Court rejected an earlier Purdue settlement because it would have protected Sackler family members from future lawsuits even though they had not personally declared bankruptcy. The ruling forced negotiators back to the table, and it made the final settlement even larger. In 2025, attorneys general from across the United States announced a new agreement. The settlement was worth approximately $7.4 billion. About $6.5 billion would come from Sackler family members. Another $900 million would come from Purdue Pharma itself. The money would be distributed over many years to support addiction treatment, prevention, recovery programs, and victims of the crisis. The settlement became legally effective in 2026. It permanently ended the Sacklers' control over Purdue. It also permanently barred the family from selling opioids in the United States. Meanwhile, Purdue itself would disappear. A new public benefit company called Noah Pharma would replace it and focus on addiction treatment and overdose reversal medicines. But even a $7.4 billion settlement has limits. Money can fund treatment centers. Money can support recovery programs. Money can help communities rebuild. What money cannot do is reverse history. It cannot erase addiction. It cannot restore lost years. And it cannot bring back the hundreds of thousands of lives lost during America's opioid crisis. Today, Purdue Pharma is gone. Its empire collapsed. Its owners lost control. Its documents became public. Its name became a warning. But one question remains. Purdue did not invent greed. It did not invent addiction. And it did not operate alone. Doctors prescribed the pills. Regulators approved the drug. Investors celebrated the profits. Patients trusted the system. So when billions of dollars can be earned from a product that eventually helps fuel a national disaster, where should accountability really begin? With the company, the family, the regulators, or with a system that rewards growth long before it asks questions? Because if the opioid crisis taught America anything, it's that the most dangerous corporate disasters rarely begin with a crime. They begin with a business opportunity.